can you safely exercise with PAH?
Great question. And I would say I love the way it's phrased because it indicates somebody who is really looking to be able to exercise. And that would be our goal for all of our patients, is to be able to provide opportunities to exercise safely. Many times what I recommend to my patients is that we refer them to our cardiac or pulmonary, or sometimes called cardiopulmonary rehabilitation. And this is a very specific type of exercise regimen that is prescribed. Usually it's a physical therapist who you would be presenting to, and it tends to be a 12-week long program where at the beginning of the program, you sit down for a little bit longer period of time with the PT, and talk to them about, these are the things I can do. These are the things that give me problems, and they look through your medical record, and then they devise a regimen of exercise that is very specific to your needs and your abilities. And then you follow that through the 12-week process. Now, I understand that not everybody is as fortunate to have, a cardiac rehab that is close to them or they can join. So some of the ways that I let people know what is safe is to listen to their body. Their body is at all times telling you information. We often ignore it because we have other things we do through the day. But when we start to feel short of breath, we need to listen to what our body is telling us and try to understand, is this shortness of breath something that indicates I need to sit down and rest? Am I feeling as though maybe I'm lightheaded? That's a way for your body to tell you, like, hey, I'd like you to slow down. So it really is listening to what your body says and continuing to try to exercise within kind of what you are learning and hearing from your own body. Now, I think sometimes, and I will just be very honest, it's scary. It's scary to receive a new medical diagnosis. It's scary to receive a diagnosis such as pulmonary arterial hypertension. And often the feedback from my patients is that because they're worried, they feel like they could hurt themselves by pushing through shortness of breath or doing too much exercise. And one of the things we do know is that when we actually studied it and we looked at patients who were joined and included in a very specific exercise regimen and physical therapy program for them versus those that we said, listen, you do what you think is right for your body. And then we followed up with those two separate groups 12 weeks later. And the group that had been involved in the very specific cardiopulmonary rehab process had much better outcomes, meaning they were walking further, they were less symptomatic than the group that didn't have a specific program. So I would inquire to your provider as to whether there's an opportunity for you to join one of these near you, because it gives you a good sense of what you can expect from your body and some of the very safe exercises to be done. I would also say that online, through the Pulmonary Hypertension Association and many of the other supporting groups for pulmonary hypertension, that they do go through some of the exercises, but they also provide videos that might be able to say, if you can't really stand up, here's some exercises that can be done while you're sitting in a chair. So please explore some of those opportunities to try and improve your exercise health.